Yes, good morning, everybody, and I'm Dr. Topaz, and in today's episode of Making Healthcare Better with me, we are going to talk about why doctors should stay in clinical practice. And this is actually a topic that is so relevant in the current state of the art of innovation, technology, artificial intelligence, and many more things that are coming around. And how do we stay in clinical practice as a doctor? Because you know that the profession is a demanding one, it's full of stress. For example, in our context in Uganda, for example, as well, your pay is not equating to the time that you spend on ward, the hours that you're investing in take care of your patients. You also need to keep upgrading and improving on your knowledge, and you also perhaps need to go back to school and so many other things. At the end, you feel a lot of tension, stress. You feel like, I don't deserve this kind of treatment. So at the end, the options you have: either drop out, look for something else to do, or else continue with the harsh employment work. But in my opinion, and in the path that I've taken as an individual, really speaking, I have taken time to analyze myself. What do I really love, and what do I enjoy to do, and how can these two, for example, my profession as a medical doctor, then my passion, love for technology and innovation, how do I merge the two? I have discovered a sweet spot, which perhaps will also be something that everyone out there can be able to use. One, first discover what do you love to do. Then the second, you already have your degree as a doctor. For example, maybe you are a clinical practitioner or a physician or else you are a medical officer, but this mainly applies to people, junior doctors who have recently come out of internship into practice. So that is the right time to do this thing. Pursue your passion, see what you love to do. How can you continue to practice with that? So in that way, you will be able to understand how do I merge my passion with my clinical practice. For example, on my side, medicine is something that I practice, and I'm not going to get out of practice any sooner. And innovation is something that I love. So I'm trying to use innovation, technology to keep me motivated, happy, and practicing medicine going to ward every day. It's like an opportunity for me to see, identify problems that we are facing in the clinical world, and I see how can I be able to create something. For example, how can I do some innovation that at the end will be able to be kind of a revenue source for me. Because sometimes you realize when you're on ward, you really need to treat some patients, but they're not able to afford some kind of investigation or some kind of medicine. So as a doctor, at some point in my own values, I value excellence a lot and I value humanity. I want everyone to feel good if I am able to offer the good feeling for them. So if you have the money as a doctor, there is nothing, there is no reason, there is nothing that it doesn't hurt for you to offer into investigate the patient, because at the end you're going to learn as a physician, and you are also going to kind of improve your knowledge, the patient benefits. So it becomes a win-win situation. Investigate the patient, you can pay their money, investigate them, you've learned, and now this becomes kind of, you add it into one of your cases that you've managed, and it adds into your portfolio. What if you're a poor doctor who doesn't have the money to do that? Then it means, first of all, you are going to drain from the patient who is already drained, poor. They are not able to afford the resources that they need. So now, this brings me to my quick point. Pursue your passion. If you love music, find a way of making money out of music. I think I know one doctor who is really he loves music a lot. It's called Dr. Brian. His stage name is Blue K. I think Blue Tiger. Yes, he loves music a lot. He's pursuing music. He's trying to see how he can earn out of music while continue to practice medicine. He's now a surgeon. Can you imagine that? I also know a physician that is called Dr. Conrad Sora. Is really an inspiring physician. He does so many things outside the field of medicine, but he's also a very nice physician, excellent at what he does. So I feel like there is no reason to get out of clinical practice. You just need to identify what you love to do, see how it can earn you money as a main hustle, may it will remain your side hustle as you may all know. It is nothing to say that it being a side hustle will compromise on the quality of care that you're going to give your patients. All that we are looking for here is actually peace of mind. And how do we get a peace of mind? Most of the time, what stresses us is finances. We don't have the money to do the work that we want to do. We don't have the money to buy the car that we want to buy. We don't have the money to build the house that we want to build. So many things. At the end, if you're financially unstable, things become a mess. It becomes difficult for you to manage your own life, manage your own family. You even becomes even difficult for you to progress with your career. But once you put that into place, then you'll be able to dive in. Literally in the early days when I finished my internship, actually my focus wasn't to become rich. My focus was to gather knowledge on the things that I really love to do. Invest in knowledge. People were buying screens, people were buying flat screens, people were doing all sorts of things to make their perhaps apartments good, look nice, and all that. No, that wasn't my focus. My focus was on education, knowledge, wisdom, understanding, and being able to achieve the desired passion that I wanted to. So, when you're beginning, I think this would be really a good thing. Thank you very much.